Hey, Dental Nachos crew, it is Paul, Dr. Nacho, here with one of my favorite people, key resources and sponsors, talking about how you can help more patients, produce more patient-centered dentistry, and maybe even have more fun in your office. Welcome Dr. Karl Koerner, who helps us learn about extractions for the GP, bone grafting, being an awesome person. Welcome, Karl, and share with us what you have for us today.
Hey, thanks. It's really nice to be here. It's good talking with you again. So what we're talking about is, of course, we had last week, but we have it coming up periodically, and it's online and hands-on both. Here we show that this is a dentist taking the course in his office.
Awesome.
So we sent a kit of supplies and the model. He needs to come up with the instruments, but usually you can, if you don't have them yourself, you can maybe borrow them, or actually over the years, I've accumulated hundreds of instruments and I've just loaned some out, if that be the need.
Great.
And also we have a company that will sell them at a wholesale. That's like the same as a Sullivan Shine buys them for.
Nice.
Which is really rare. I mean, how often do you see something like that? So anyway, this is how it goes.
Now, what Karl, I want to say, like, some people, they think I'm young, which is nice, but I'm not very young anymore. I'm 43 years old, right? So in the olden days of the beginning, this didn't exist, right? So there's been some good unintended consequences of this very annoying pandemic. So while you and I are both fans of in-person CE, the world has become very difficult to travel and do things. So now, not only can you do this from your office, if you have an implant motor, where else can you do it from?
So, this is in the office and you're looking at things full screen, and I do it on the model and you do it on the model. But then I'll just put all this stuff up right here. Okay, so what this is saying is that with other dental disciplines like restorative, you may need a high speed, but with us, yeah, you can use a high speed, that's no problem, but you could also use a lab engine or electric implant motor with a straight attachment and do it at home.
That's great. So just $93 you go at home. And
well, that 93, that's from eBay, but you don't have to even buy that. We can loan that to you too.
And I like you. So a couple things I want to say. One, you need one more red dot at the bottom that says spend more time on your couch. So before he was Jay Pritchard from Modern Family, and my team member is going to laugh this, he was Al Bundy from Married with Children. And I will never forget, as a child, watching that show, which now thinking back, wasn't always made for a child. I remember when they planned a staycation in their home, which I thought was awesome. So now if you want to get your life down to your couch, learn, watch TV, drink wine, have coffee, you can help. So please add a red dot there that says more time on your favorite place, your couch. So share with us. So basically, if you're a dentist watching and you say, I want to do more extractions, I want to do more bone grafting, walk us through how this is going to work.
Okay, so basically you register, you gather the instruments, and we can help you do that. You get the model and the kit of supplies in the mail. And here we have 20 some odd people, that it's great. I can look at them. I can look them in the eye, while they're taking the course. I'll tell you, half of these are in their kitchen, to be honest with you.
It's another place I like too, very close to the snacks, right? Couch, kitchen. So now you can now I want to tell everybody, when the world opens up again, you still have to come back to our CE courses. We do need to see each other face to face. But while this time is happening, patients need help. As we've talked about since the beginning of this pandemic, Karl, it's still very challenging to refer people out of your office for anything. So anything that you can add to what you do is going to help people in the moment. Yeah. So these people are going to learn extraction bone grafting at home. It's 2 full days, and you guys are offering it right now at half price. Tell us about the investment or the cost in it.
Okay, so before COVID, we were filling it up at $2,400. But we've cut that price in half because of COVID. And so we only want like 15 or 20. We don't want too many people online. We want to be able to have conversations. It's $1,200 now though. So this is what they may see. They may see Dr. Davis teaching it with me. We just, on the modeler, this is what they see. We just did a bone graft. They did a bone graft with cross horizontal mattress sutures, and then a wisdom tooth is being extracted, in the bottom right corner of the screen. And then, right here, they did a cross horizontal and a releasing incision. And, doing that suture for the releasing incision for some general dentists is problematic. I mean, like, which side do I start on, and how do I do it? So they've been practicing that on the model. There, that girl is using a luxator, into the PDL. So it's amazing just with the camera that they have on their computer, all the things. And I think this is the last image where this pediatric dentist on the upper right, she said, I've got this case. I want to talk about it. Can we talk about it? And so we had everybody talking about
That's
it.
great.
And so that first molar down there has to come up. But what if you luxate? What if you put the elevator in there? The adjacent teeth don't have any roots. They're going to come out instead of the first molar. So we were talking about the ways to do that, and how to do it and not have a problem. And so they can, at the end of the course, we always have Q&A, and then they can present, and then we spend like 45 minutes or an hour just talking about group issues, different things from their office.
I mean, this is just truly awesome that you guys are doing this. I want you guys to tag also. You are such a humble and kind person, Karl, but we've gotten so many dentists like Dr. Chance Bodini, Dr. Travis Campbell. Every time we pop up your name, they say, do this. Dentist, whether you're a baby age dentist, a medium-age dentist, all of us have people that need help with extraction and tooth removal. Figure out if you want to do some, all, in the middle, maybe just a few, but it's a real opportunity. And one of the things I'll share about the instruments, Karl, is that it's also probably a good opportunity to just get a set of extraction instruments for your office anyway, right? Whether you or someone else doing it. You may have an associate, but associate dentist. Let me walk you through this. And if you want information on this, just text Karl to 55444. You get a Nacho TLC intro from our key resource and sponsor. If you're an associate dentist, you pay $1,200. You just have to produce $3,600 of dentistry to make this worth it and have the skills forever. And when you're doing cases that are $400 to $800 or multiple extractions that can be $3,600 in one sitting, you pay for your investment and get to feel better about what you do, help more patients, have more fun, and make yourself, at the end of the day, make yourself more valuable to the office. Put down in the comments, make yourself more valuable to your dental office. So I think that's awesome, Karl. How can people reach out to you guys directly to learn more about this?
Well, at Koerner Center, in fact, my name is on this image right here. So just KoernerCenter.com.
Present. Any other slides you'd like to show us here?
No, but I would like to say that we have this one in November. We have the Nicaragua patient treatment in December. That's on the website. We have a 90-minute webinar on one extraction in like a ton of detail. That's a webinar on the 29th of this month. And then we have third molars, a two-day third molar course where we go into all the angulations. We don't want to encourage people to do them if they overlap the mandibular canal. So, but they can do those if they want, but the emphasis is on all the different kinds of third molar impactions. And that's an 18-hour course. Some of it's online. Most of it, 2/3 of it's online. And then the rest is actually observing patient cases, patient treatment. So that's coming up in February.
And I love all that, Karl. So you guys can text us, reach out to us at dentalnachos.com. You can also text us here. And as someone who's been back in their office, just in my office yesterday, been in dentist for 18 years, practice owner for 15 years, I'm always observing different business trends. One of the reasons I think extractions, bone grafting, and implants are doing so well during the pandemic is because there's no other option. When you need a tooth out, it has to come out. And then when it's not there, you need it replaced. So while people may be putting off cosmetic cases or putting off other stuff, there's really not an opportunity for them to put this off, and we can be there to help them. Have you found that as well, Karl?
Yeah, certainly. Yeah. So yeah, especially in these times, surgery always does well.
Yeah. So we appreciate you being an awesome key resource and sponsor. If you ever want to be featured on this, just reach out to us at salsa@dentalnachos.com. Thanks for being you, Karl.
Thanks for having me.